Dear colleague, welcome to the introduction lecture to the course Movement Disorders in the WSSFN Course Series in Functional Neurosurgery. There is a large unmet need in neurosurgery in the world, and it is estimated that an additional 24,000 neurosurgeons would be needed to cover an additional 5 million procedures per year, which should be done. And this unmet need is larger in more unusual therapies, such as functional neurosurgery. If you want to learn functional neurosurgery, the best thing is of course to get a good teacher that can provide you with years of bedside training. But unfortunately, the number and time of potential teachers is limited. And even if you're lucky enough to work at a big department in a rich part of the world, it is unlikely that all fields of functional neurosurgery are well covered at your own department. One can of course go and visit someone for a couple of days. However, this is more for getting inspired, and when people are visiting me, I doubt that they learn much. We can further visit a conference or consult the literature, but the literature is often too scientific and does not tell you how to do. Finally, we have our traditional courses, which are great but of limited availability. For that reason, we have decided to create the WSSFN Course Series in Functional Neurosurgery, provided by the Stereotactic Academy in collaboration with the ESSFN, the INS, the WFNS, and a number of other societies. This course series is a unique creation with an outstanding faculty of more than 100 of the leading experts in the field. The focus is on clinical knowledge, how to do things, and the complete course will in more than 200 lectures cover the essentials of all fields of functional neurosurgery. It is a unique possibility if you are a resident in neurosurgery and you would like to widen your horizons, or if you are already a specialist and would like to enter the field of functional neurosurgery. And the additional material provided will let you journey far above the essentials if you find any aspect to be of special interest. The course series consists of 8 units based on the well-renowned ESSFN hands-on training course, of which this is the second unit, Movement Disorders. The remaining units are planned to be made available online during 2024 and 2025 and will cover basics of stereotactic neurosurgery, psychiatry, basic science, pain, spasticity, epilepsy, and lesional procedures. And CME accreditation will be sought at the end of 2024. You can take the whole course or just the units which you find of interest. All content is intended for self-studies and provided online at the Stereotactic Academy. You can access this whenever you want and wherever you are as long as you have an internet connection, and all content is completely free. This concept has been appreciated among our more than 2,600 registered users, and our previous courses at the Stereotactic Academy have been well received. The Stereotactic Academy consists of 2 web pages, stereotactic.se, where we for compliance reasons have only the CME courses, and where the current course series will be housed, and of stereotactic.org, which is the go-to place where we have all content and all additional material. Thus, you join the course on stereotactic.se, but if you would like to learn more than is covered in the course, then you can always consult some of the other 250 lectures at stereotactic.org. The course units can be taken as they are, but also in combination with in real-life courses. In real-life courses can be quite hectic, and it is a good idea to use the course unit at the Stereotactic Academy as a pre-reading material. If you are familiar with the topic, you will benefit more from an in real-life course. Further, it is difficult to remember everything, and the Stereotactic Academy is always at your disposal when you need to refreshen your memory. The current course unit, Movement Disorders, consists of 24 lectures. We are constantly updating the content, so the curriculum might change over time, but you will find the updated curriculum at the Stereotactic Academy. Please note that some lectures are also part of other curricula. They will sometimes suggest you to continue with other lectures or to do some exercises. But lectures and exercises not mentioned in the curriculum are not part of the present course and can be ignored. Please note that this is a continuation of the previous course and that you should repeat the lectures on the history of surgery for movement disorders and the 2 lectures dealing with DBS for movement disorders if you do not remember the content. You might also notice the lack of lesional procedures in the curriculum, but we are saving these to a later course on lesional procedures. The course unit is divided into 5 parts. In the introduction, we will discuss the world of DBS, how to build your team, and how to increase your practice. We will then continue with the anatomical and physiological background of the treatments and of the movement disorders of interest. We will then look at different indications, and please repeat the lecture from the basic course before moving on to DBS for essential tremor, dystonia, and Parkinson's disease. The next short section consists simply of 3 videos with information to patients regarding DBS for the common movement disorders. It is very important that the patients have reasonable expectations, and a well-informed patient is a prerequisite for successful therapy, and this is just an example of how I myself inform the patients, and you can watch these videos cursively. We then continue with targeting for movement disorders. In the basic course, we discuss targeting in general, how to calculate coordinates, improving accuracy, and how to verify that the electrode has ended up in the intended place. Here we will now look in detail at how to identify the targets in the VIM, the caudal zona incerta, the STN, and in the GPI. And please have a look at the targeting exercises. We have many available cases that you can download. Here you can do the targeting according to the instructions in the lectures and then compare with our suggestions. And in the final section we will discuss how DBS works and various aspects of programming. We will focus on what is generally applicable and also have a brief look at visual programming, adaptive simulation, and teleprogramming, before ending the course with a lecture on DBS emergencies. If you would like to have more details regarding how to program the individual targets for various conditions, then you will find such lectures at stereotactic.org. And after you have finished the course, you have the possibility of performing a test, after which you will receive a document confirming your completion of the course. In order to get access to the course, please register at the Stereotactic Academy at stereotactic.se. And please remember to at the same time also register at stereotactic.org in order to get access to all the additional material. And with that, I end this introduction and greet you welcome to the WSSFN course in Functional Neurosurgery for movement disorders and to the Stereotactic Academy. Thank you.